I'm Mark Halperin. Welcome to Wide World of News. We're talking today to Americans around the country who are concerned citizens. They're concerned about what's going on in their communities, in their families, and of course, for the country as we deal with this crisis. The challenges are many, and hopefully the opinions tonight will be many. I want to welcome you all to the second of our discussions, Wide World of News reader discussions. And I want to start by asking the question that, of course, has gotten a lot of attention of late, which is, are we opening too quickly? Are states making the decision, encouraged in some extent by President Trump, to reopen civic society, businesses, etc.? Is it going too fast for your taste and your judgment? Lynn Schmidt, the nurse in St. Louis, if you could go ahead and weigh in on that.
I do think so. St. Louis is different, and Missouri is different just because the majority of cases in Missouri are in the St. Louis area. I actually live in St. Charles County, which is right next to St. Louis County, and we're opening up, but I mean, we're right next door to each other. So I think it's just really complicated, but I do think we are opening up too soon.
What do other people think? Pete, do you think we're going too fast, too slow, or just right?
I think we're going about right, maybe a little bit too slow. I think that we could be more aggressive in opening up. You know, the original intent was to flatten the curve so we wouldn't overwhelm the healthcare system. I think we've largely done that. Based on my reading, is that the infection is going to spread pretty much as it will spread over a length of time. So it's a matter of, people are going to get sick sooner or later, but the people who are going to get sick may ultimately get sick. So we want to have it so we don't have a chance of people are dying in the streets, so you can go to hospitals. But now's the time to sort of let people out, start reopening the economy, and then we'll deal with these things as they develop.
I am concerned, Mark, about going too quickly. I was with my daughter last night at a distancing supper in our family, and she has a little boy who is 7. And I asked her about the schools because we know how crucial that is to the economy itself opening. Schools have to open in order for people to go to work. And I asked her, she has her own company. She's working from home as everybody else in her company is. And I said, Elizabeth, if they open the schools right now, will you send Jack? And she said no, and that she had thought about it a great deal and does not feel that she's willing to sacrifice the possibility of her child catching the virus when there's only 6 weeks left of school.
When you look at the age breakdown of people who get sick and people who get ill, you can see that for people under the age of 19, it's almost zero. It's remarkably low. In fact, today, Sweden has allowed people under 10 to visit grandparents because they determined that people under 10 do not carry the virus, cannot transmit the virus, and they're like totally immune. So I think that.
Yeah, but that's unproven. That's unproven.
Yeah, I'm not sure I believe that either.
Yeah. Do you have a child?
But whether I have a child or not doesn't change the studies. That's the people in Sweden that aren't exactly the radical kind of people either. So this is a study in Sweden, which is published in the BBC. So I give this some credence based on that. Yeah. And when you look at the hospitalization rates, here's a little chart I prepared that shows the bars are hospitalization rates by age. You can see way off the left side is almost zero for below 19. And then you look at the line goes up, that's the death rate. So people get sick pretty much proportional to their age, but if you're above 75, that's like where 80% of the deaths are. So the chances of getting fatally ill, if you're below 40, is like small, really small.
I'd like to see the research that shows that children aren't transmitting it to older adults.
When you get off here, Google the BBC article from the Swedes that shows that they've determined that the children under 10 don't have receptors to transmit the virus. I didn't, I saw it on Fox News or something. That's just basically from the BBC in Sweden for the crying out loud.
Well, that's great, but I wouldn't want to have to wait to find out. I would rather wait and find that out in the fall rather than now. I think it's too soon.
Well, when you look at the hospitalization rates, you can see right now that the number of people, like for instance in San Diego, in California, there's been zero deaths below the age of 17. Zero.
Let me ask you for a show of hands for the group. If your favorite neighborhood restaurant opened up and they said, we've got this covered, we've got our staff wearing masks and We've got the tables a separate distance. Raise your hand if you would go to a restaurant tomorrow. Okay, so three of you would.
I would go and support them and do takeout curbside.
I would answer that maybe in three ways. One, I think the decision has to be local within the state. Here in Arizona, the hardest hit areas are the Native American reservations, unfortunately. Here in Scottsdale, we have a remarkably low infection rate. And I think in such areas, if the governor and the medical people say we have ample hospital capacity, ample ventilator supply, and ample PPE, then I think we can start opening up. And the second part of that would be, obviously, that's an individual decision. Just because a restaurant is open doesn't mean that somebody has to go in.
Mark, I got 2 quick points. One, I've seen the studies that Pete has referenced. They're very good studies. I would caution, however, against using the data from another country and relating it to what happens here in the United States, because those countries have been able to use measures to stem the growth of the virus that we can't use in this country because of everything, a number of the things you're seeing now, protests, people challenging in courts, those sorts of things. Those countries have tools in their toolbox that we frankly cannot use. And the second quick point is that while I don't think we are opening up too quickly, I do think we're opening up irresponsibly. And I think that's a different thing.
Ray, just say a little bit more. What's irresponsible as you see it, either nationally or in some states?
Well, we should have, and we don't have, some consistent criteria across the board on what businesses should do and what consumers should do when they go into stores. So for example, in some states and even in some counties, I mean, you can go county to county even in some cases, business owners and their staff, some have to wear masks, some don't have to wear masks. Some businesses are going to have hand sanitizer at the front of their store, some will not. Some are going to have partitions between the tables, some are not. So what are those standards that we can use across the board?
That's
for
organized
everybody?
in New York. In New York, that's organized.
But it's not organized across the entire country.
And
And
it
I know
won't be.
people will say, well, that's not a big deal, but sure it is. Because if you live in Lower Manhattan, you can go right over the Lincoln Tunnel and be in Hoboken in 15 minutes. And if they don't have the same standards,
Well, how's that going to
that-
happen?
well, that's pretty simple. If you have leadership at the federal level, it's simple in
don't.
theory, I should say. It's simple in theory. If you have leadership at the federal level that says, look, folks, this is really what we got to do. Do this,
course.
do this, do this, do this. We
But we
don't
don't have
have
that.
that. We
Well,
don't have
We're
that.
not going
Right.
to have it.
Well, the issue is really one of personal risk tolerance. I mean, we all make daily decisions as to what we're willing to accept in ways of risk. You know, we've all compromised on a national speed limit of 65 miles an hour. We've compromised on letting people smoke cigarettes, and all those have risk trade-offs and health trade-offs based on some kind of acceptance that, well, it's worth the risks to have a transportation system. This is no different. We need to.
Oh, I would absolutely disagree
on.
with that.
We need to manage their risk based on people's
Hello.
acceptance of the risk.
I'd
No,
like to
I
ask a
think-
quick question.
Joe, go ahead.
No.
Why have we accepted over 240,000 people that die in this country every month, and all of a sudden we are shutting down the country for that's probably 10-15% of that each month? Why is this not acceptable?
Exactly. I mean,
Now that's
No,
an
I'm
interesting
asking why are we
philosophical
shutting down the country for a small amount of people when we lose 150,
Small amount is
200,000
not-
people a month?
It's not a small amount.
So that's an interesting
Well-
philosophical question, right? It's an interesting philosophical question because
No,
there are
it's
one
not a
of two ways you can
philosophical
go.
question.
Yes, it is a philosophical question because if you are in the category of keep everything open, don't shut everything down, and I'm not arguing that that's right or wrong, then what you are acknowledging is that a certain number of deaths, and according to most of the research, and I know Pete likes research, so according to most of the research, you're talking about millions of deaths So if you want
No,
to keep
you
it
don't have the
open,
facts for that. You don't
no,
have the facts
no,
for
no,
that
no, no,
because
no, no. Yes,
research
I
hasn't
do.
proved that.
Yes, I do. The CDC, which is the federal government arm for this, has estimated that if there's no stay-at-home order and everything goes as it is, you can get as many as 2.2 million deaths. That's from the CDC. That's not from me. So the philosophical issue is that okay?
That's not a research. That's just models. Very
Yes, and
different
models are based on
model and
science.
research.
No,
Because
no,
we
no,
have
no.
not had a
Models are based
research.
on science.
Excuse me. We have not had a
No.
research that
No.
that has a control factor and has just what is going on.
No,
And we
no,
can't
no.
sit around and wait for
Those
that.
initial scary models are based on everyone assuming that the transmission rate would be the same as it was in New York City, which has proven out not to be the case.
And that's not
I
accurate
live in
either.
I live in Iowa. We have 123 people that have died in this state. Why are we closed down?
Because you have meat packing plants.
You
Well,
want
that's
to eat?
why it should be on a local
No,
basis.
what does that got to do with it? That's always been the case. We don't close down for the other people that die of the flu.
That's the philosophical question.
Wow.
Ari,
That's
Ari,
the
I'd love to
philosophical
get,
question.
Ari, I'd love to get you, and you're in Maryland, a state whose governor's been pretty high profile in trying to grapple with these decisions about how to reopen. Where do you weigh in? Where do you come down on this question of individual risk taking as the rule versus national or even state by state rules?
The point that I've brought up many times to friends, from where I'm sitting now, and I realize this is quite different than upstate New York or Dayton, Ohio, or Southern California, or Iowa, within a 1 hour drive in moderate traffic, an hour and a half in rush hour traffic, I can be in the District of Columbia, Virginia, West Virginia, Maryland, Delaware, and Pennsylvania. That's two hands. So I'm all for our federal system, and I think every state needs to do what they need to do. But from where I'm sitting, these are in many ways very different states, but these are also states that, for want of a better term, cross-pollinate. Regarding the individual responsibilities and what have you, I was thinking about this because it was the first time that I went on the highway in a long time. I had to run out and get something, and the highway was empty. But I know every time I get in my vehicle that there's a risk, and I'm only as secure as the worst driver on the road. But I also know, I don't know the details, but I know we have a National Highway Transportation Safety Administration. I know there's airbags in my Chevrolet, and I know there's generally standards that prevent deaths. But I also know that unfortunately tens of thousands of Americans die every year in automobile crashes. I don't know what the government agency that corresponds to NHTSA is for this. And I don't know that, even if I knew that they would have something similar to an airbag to respond to the quote unquote worst driver on the road. Meaning, for example, the 10-year-old who goes and visits his grandmother in a nursing home and then crosses state lines and coughs on someone in the restaurant that just reopened, even though that 10-year-old is doing great, God bless him. His soccer team's just reopened for the summer season.
I think what you described there is that you feel driving is better because you can manage your own risk better. This feels more scary because it feels like such a random event where you walk outside and you're struck by lightning and it's sort of scary. But I think that we can manage your own risk in this by washing your hands, wearing a mask, keeping yourself healthy. You're managing your own risk, and you shouldn't be tied down to where you quote, can't drive your car because there's crazy people out there.
Well, Pete, let me ask you this, because this is something I hear from every day. I hear from readers about this. They go out to their supermarket or they take a walk and they see lots of people not wearing masks. They see lots of people in close physical contact. Isn't it the case that you may say, well, I'm happy to manage my own risk, but isn't it the case that if Americans don't do a better job than they seem to be doing now, that people are going to be putting others at risk, and that's not something an individual can manage? Well,
I think unless you let somebody cough right in your face, I think the of study are low. When you read the study in South Korea, I talked about their transmissions. It was done by people in a call center who sat next to each other for hours on end.
Come on, Lynn.
The random walking by someone in a grocery store and all of a sudden you catch 3 molecules of COVID, I think it's remote.
No. I mean, it's 6 to 10 feet. I mean, they thought it was 6. Now there's.
Those are the scary studies people put out there that show it's theoretically possible.
No, they're not just scary studies.
And they say, if it happened once, therefore it'll happen all the time. And it's not that. It's not.
No, it's science. there's actual data. I mean, they can measure the distance of transmission, and
Well, but they don't, they can measure
on
the distance
surfaces
of
for
how long
up to
molecules can go into
hours.
the speed, but they don't know, A, how much it takes to get you sick. They don't know a lot of stuff about transmissibility, about this whole virus. It's all sort of based on
Goodness.
people's best.
You know what's great about this? I
What?
love this conversation, and I'm so glad that everybody's taking the time to do this, because it points out something that I've been saying for a long time. Data
What's
does
that?
not matter. Science does not matter. What matters is how you interpret the data and what you believe. Your belief system drives whether or not you believe the data. So therefore, yeah, there are 123 people that died in Iowa, right? Is that good or bad? Depends on your belief system. It doesn't weigh whether or not we as a society believe that not taking action is okay, as long as it does not intrude on our own liberties and other people die.
Well, I believe that we,
So-
I think every group, the group we got to protect is those over 60. And they have to help us protect them. Because that's where the vast numbers are that end up dying. And that can be done, because a lot of them, nursing home, I think it's a national disgrace of what has happened in our nursing homes in this country.
But if you listen to
Yeah,
Pete,
let it
those are just
happen.
scary numbers.
Oh yeah, they are scary.
But they're Pete, are they accurate?
Yes, they're
False.
accurate.
Yeah,
Oh
because
my
they're
God.
dead.
80% of the deaths are over 65, 80%.
Right.
So
I mean,
I'm
And
confused.
the life expectancy of someone in a nursing home is 13 months without a disease.
And,
Oh,
and- and-
wow.
and the one person
I
brought up the
Everybody has
packet
an
plan.
argument
Time.
about
That's why
this
they're there.
tonight.
Go,
The
Jude,
packet
go
plan.
ahead.
I have a
Number.
child who's immunocompromised. She's not in a nursing home. She
You
is,
can manage that risk. You can manage that
no,
risk.
she is at risk, and I can't.
Then you should manage it. Don't let her out.
Oh, wow. You're being really unkind
So
here.
I shouldn't go off because someone else has a child that's immunocompromised.
No,
I
no.
Yeah.
But here's the problem with the disease. You should go out. You should behave in any way you want to behave, but your individual actions can infect other people. So it's not just a decision that you make about you. And what I'm just saying, I'm saying you in the general sense. It's a decision that you make for other people. And when you're dealing with a disease that's got dramatic spread, and I'll give you that, we're at the beginning of really understanding what this is. We don't know all the science. We don't know exactly what's right. But we are confident that spread in this particular virus is lethal and deadly. And if we have time later, I'll tell you a personal story about a friend of mine whose nurse works in an environment that Pete would be stunned by, ended up getting coronavirus.
For those who believe we're reopening too fast, what is your answer to all of these small business people and the people who are out of work? Putting them on enhanced unemployment where they're making more not working than they are when they do, I don't think is a sustainable answer. When you look at the economic toll here, there has to be a balance. It has to be on a local basis. The fact that, yes, there are individuals that are more at risk than others, but if you have sufficient medical resources and even more importantly, sufficient testing, which is being ramped up. The governor of Arizona is having, it's like a test for all the next 3 weekends. So he's aggressively ramping up the testing here. So I think we have to think beyond individual situations and the individual horror stories. Yes, there are going to be horror stories, but if we look at the country and our community as a whole, we have to reach a balance sooner rather than later to get the economy up and running.
Right. And I think everybody's moving toward that now. The question was just, are we?
Why do you think that we're opening up early then? Here in Scottsdale or Iowa or other areas, people would be very comfortable opening up, where people in New York and densely populated areas, or people who are at the front line of the COVID crisis, God bless the medical people, from their own experiences, they may not be comfortable. That's why
We're working toward the next few weeks, actually. I mean, that's New York.
Can I follow up on something Bill said?
Yeah, please.
here in Missouri, we still don't have testing. My husband's an ER physician. He still has to triage the people who can get tests. That we're nowhere near even able to test the patients who think they have coronavirus, let alone the larger public. And you mentioned something about PPE. He also still does not have enough PPE.
Well, here in
He
Arizona,
has the same N95 mask that he has to keep it in a bag with his name on it and use it every shift that he works. He
I
can't
understand
get
that
one every
if
day.
that's your local situation, but I don't think that should drive the situation where a governor can certify or state with as close to factually as possible. The hospitals have capacity, the ventilators are there, the PPE is there, and
No, it's not. It's not though.
Here in Arizona, we're told it is. It may not be in your area. And that's, I think, a view we have to have a broader and not necessarily be affected by our local area like I am, because people here are feeling cooped up when the people in the medical professionals are saying we're doing okay, where in your situation, at least in your neighborhood, your husband's hospital, you're saying not. But that's why we shouldn't go on just one data point. We should take a broader view and let those areas that are comfortable loosen up, knowing that you might have to tighten down.
I have a question. I guess I'd throw it to Bill or to whomever. I know I've been doing a lot of it and thinking about what the month of May 2019, a year ago, looked like, and what a typical week looked like, and what kind of businesses I was, essentially my personal economy. Where was I spending money? Where was I going? And for that matter, my wife. And I'd be curious to pose to you, Bill, since you brought it up, what elements of the Arizona economy, I'll admit I've only been there once, but it seems pretty tourism driven, a beautiful state. But what do you think? I mean, when you say we should reopen the economy, I imagine all of us agree on that, but going sector by sector and what a typical month looks like for the average American, it seems
the tourism and hospitality sector here has been devastated. April is a high month for tourism. And obviously with social distancing, traveling on airplanes, there's that. How do we slowly, reasonably open that up? I think that's for the doctors and the governor to decide. The other areas, the small businesses, like everywhere, we live within walk distance of I call it a lifestyle shopping center. Already 2 small boutiques that we know were doing well have now shut and said they're out of business. And that's happening more and more and more. They could have reopened now with social distancing. It's not on a good day they have 20 people in the store, yet there's 2 small business owners that are out of business. So that's why it needs to be on a local basis, using reasonable standards and understanding there is a risk. Nothing is risk-free, as we've talked about. You walk outside, something could happen. I'm waiting for the first story where someone in a mask crossing the street in a crosswalk is hit by a bus.
Now, in addition to the economic devastation we're seeing, there's the opportunity cost of other health maladies not being discovered. For example, 20,000 women a month get diagnosed by breast cancer. And I'd say for the last 2 months, that's been like 0, or very small. So what's the cost in a year and a half of women who has delayed diagnosis may have a bad outcome from breast cancer based on this, and probably a dozen other diseases which aren't getting diagnosed, preventative care is not getting done, and those maladies evidence will show up later on, and they'll cause their own number of deaths. So we have to trade off not only the economic devastation and the deaths that may result from that in terms of the deaths of delayed medical care, which is real.
That's
an
already
excellent
changed
point.
in New York. That's already changed in New York. The hospitals are already opening sections of the hospital to take care of those sorts of things already. So I don't feel like that's a reason to just so jumpstart everything because of one data point. I mean, I'm a woman, I'm concerned about it.
But they've been closed for 2 months. They've been closed for 2 months where you can't get those kind of medical services.
Yeah, but that had to happen.
Yeah,
Because people
apart from
are dying.
Georgia, I don't know any states opening up so-called everything. Here in,
No.
again, Arizona,
Right.
governor, starting tomorrow, is allowing elective surgeries. I have a friend whose knee has been painful, whose knee replacement surgery was put off. I have another friend who had one cataract done at the crisis, and his second cataract procedure was canceled, and it's driving him nuts. He can see well out of one eye. So I think, again, local with reasonable precautions.
And Bill, I would say to that point, you know, I am certainly agreeing with you on that point. I have a good friend who's one of the only oral surgeons in the state of New Hampshire. And he had to apply for the PPP program. He shut down his practice for 2 months. And, you know, I would hope when we look at the American economy, healthcare is such a large part of it. And beyond oral surgeons, certainly dentists. I'm thinking also of our dog's veterinarian. These are generally small businesses, if not almost all of them are small businesses. And I would hope that these kind of healthcare professionals could come up with SOPs.
Yeah.
I would definitely put that in the bucket of ASAP. There's no reason they can't be opening, but I'm not a healthcare professional.
Let me ask for a couple
Good
show of
thought.
hands on some issues, one of which Ari just raised, which is raise your hand if you would go to a dentist appointment in the next couple weeks.
I was there today.
I would.
Really? Who
Yeah.
just said they were there today?
Cracked tooth. It was not an emergency. There was no pain, no discomfort. He comes into the office every morning to handle situations like this. He said that next week they're calling back some of their hygienists, and they'll be going back to cleanings. Now, the office manager said that they're pacing the appointment so that you show up, knock on the door, they'll have your temperature taken, you'll be ushered right into the hygienist station. There'll be nobody sitting in the waiting room, but yes, there'll be other people in the adjoining stations.
Was your dentist wearing a mask?
Oh, jeez. Yeah, he always did. In fact, I was kind of joking with him. I said, boy, you look a little bit different than when you were in dental school. And he said, yeah, HIV and hepatitis B scared the crap out of all of us.
All right, I want to do a couple more show of hands, please. Raise your hand if someone bought you a free ticket to Paris for you and a loved one, and you could fly to Paris. Raise your hand if you'd go tomorrow to Paris on a plane. All right.
No, only because there's nothing open.
Aside from-
All right.
Otherwise, yeah,
Good
sign
point.
me
But
up.
assuming there was something open, I'd go.
One more question I want to ask you about is not about something you do, but your view of the country. Raise your hand if you think the country has shown great perseverance so far in dealing with this crisis. The country's shown great perseverance. No.
Perseverance.
Perseverance.
I'm not sure what you mean by that, Mark. Elaborate what you mean by perseverance.
Yeah, please.
I mean, do you think we've stood strong and we're getting through it in a way where we're not fearful and we're standing our ground and dealing with it as opposed to being fearful or confused?
I think one thing that was good, they opened up the beaches here in San Diego yesterday, and I walked up and down the beach and talked to everybody who had talked to me, and with 6 feet apart, wearing my mask, of course, but nevertheless, people were in good moods. They're all ready to get out. They're ready to go to restaurants. We got to remember that the voices we hear on Twitter or the cable news are amplified onesies and twosies, and don't reflect, from my view of the people in Imperial Beach, sort of the general middle of the country.
Mark, I would say that given the abject lack of leadership from the president and Congress on both sides upon everybody's house, I think that everyday people have shown perseverance. I think for the most part, they've complied with the social distancing and have come to grips with everything being shut down. I think they're being very patient, and I think the protests are just a small sample of people. I think some of them have been organized on a political basis to try to make a political point. But no, I've been very pleased with the American people cooperating and being patient.
Joe, have you
Right.
been out and about in your neighborhood?
Well, like I said last time, I mean, I've been kind of locked down, my daughter and I, for the last 23 months, so I'm used to it. I only go to the drugstore to get her prescriptions. I go to the grocery store, I get gas for the car, and I go to a place to get some donuts. That's
And have
basically what our
did you-
life is. So I'm used to it.
Did you do any of that today?
Yeah, I was there this morning.
What was it like compared to normal?
Well, I think corporate America, I think hospitals, administrators of hospitals, excuse me. I'm not talking about the doctors and the people that do the actual work. I'm talking about the administrators, the way they've run the hospitals. I thought they would have had a contingency plan for something like this, where they would have the ability to keep doing what they were doing medically and handle an emergency. Same thing with businesses. But what I realized is what we have is inventory on demand, and there's nothing backed up. The grocery stores, it's an embarrassment to walk into a grocery store in America and the shelves are empty to a large extent, and you can't depend upon what's going to be there from one week to the next. That's the way it is out here.
Hey,
And
Joe.
It's
these
everywhere.
packing plants continue to go.
I'm only seeing paper, toilet paper and paper towels low. Everything else seems to be normal out here in San Diego. I don't know what.
Well, you're lucky. Yeah.
Yeah,
Where are
very
you?
lucky.
Where are you,
Joe, what haven't you been able to get?
Canned fruit.
Really?
That shelf's always empty.
Huh.
Wow.
Forget about butter.
Where are you,
They,
Joe?
they actually had some butter in for the first time in a week, and I just, that's been the biggest shocker to me is corporate America. And I'm a huge supporter of the private sector, but they better start looking in the mirror and start realizing they haven't done their jobs. They should be driving this country, and there shouldn't be questions about testing. There shouldn't be questions about masks. There shouldn't be. They should have done that on their own and done it. That's. It's like there's no initiative left in this country. Everybody's just. I'm going to make a statement here that's probably not going to go down well, but I'm going to make it anyway. The country reminds me of the Superdome during Katrina, when the poor people that had to go in there stood there and was expecting people to take care of them. We can't expect anybody to take care of us. And I agree with Pete. We have to step up, and all of you. I mean, I think all of us know we have to step up and take care of our own first. Like Lynn said, she's got to protect her daughter. I got to protect my daughter, and that's going to come first. And I don't expect any of you to change your life, lose your jobs because of that. I take care of her.
Hey, Joe, I just, in case you don't hear it enough, you're a good dad.
No, I just do the best I can.
Well,
No, I'm not a
thanks.
good dad because I did things many years ago that blew up a family. No, I gotta
Well,
make up for that.
but you are today.
Well, I try.
I want to
It's
talk
not
about.
fun being a caregiver. It's not being fun. I found out for the first time what it's like to be a caregiver.
It's
It's
hard
a
work.
very, very difficult thing.
Hard
and
work.
A lot of
boy,
people do that
res-
every day. Every
Exactly.
day.
And I respect the people that do that. And
Amen.
they just don't, they have no support. They're alone. This is the only chance I've had in in 8 years really, to connect outside of my world.
Oh, that's
And
good to hear.
Well, that's
We're
good.
glad to have you here.
Well, no,
Good to hear.
this is kind of like, stepping
Some
out.
extra care.
My
Some
little
extra care
bubble,
for you.
my little bubble, because I love politics and I love all this stuff, and to be actually engaged and listen. I'm enjoying listening to the rest of the country. I went to boot camp in San Diego, by the way, too. So I love San Diego.
I want to sneak in two more topics and then finish up. And first, it's a straight up political question. Regardless of who you want to be elected president in November, raise your hand if you think President Trump will be reelected. And raise your hand if you think Joe Biden's going to win. Pretty much split down the middle there. Lynn mentioned her husband, who we talked about last time. He's an ER doctor. He's working hard. Lynn told me earlier today he saved another life yesterday, and also working harder for less pay, which is true of a lot of doctors in this country now, regardless of what kind of work they do, what kind of practice they have, or whether they work in a hospital. So, Lynn, you mentioned an idea to me earlier today. I'd love for you to share it with everybody, and I want to talk a little bit more about the medical profession. So go ahead, Lynn, if you would.
Yeah, so here, you know, my husband is being exposed and at great risk to himself and bringing it home to our family. And he's doing it for less pay now. And so my question was, why on earth would he and other people on the healthcare front lines continue to do this? I mean, obviously he has a calling and this is what he wants to do and he's very good at it. But we need to somehow incentivize those frontline healthcare workers because there will be more waves of COVID. It's going to happen. And, you know, I kind of think of it almost like my husband being in the military. It's almost the same. They're asked to fight an enemy. This one is a virus, right? And they're asked to fight without the appropriate materials. And there's just no incentive for them to continue to do this. So yeah, I had a couple ideas about perhaps thinking of it more as like service. Like my husband went to Mizzou, University of Missouri. He serves the people of Missouri. Perhaps they could offer some sort of med school loan reduction or something like that, or disaster pay or a disaster bonus for the doctors, nurses, even, you know, cleaning people for the hospital, all those people that are continuing to work really, really hard during this time.
I agree with that, Lynn.
Wonderful.
I think they should do that by the same thing in the military. I was in the Navy, is make duty in those high risk professions like healthcare and even people in meat processing plants, give them some hazard pay plus make their pay tax free. It's the same thing the military gets, make their income tax free for the months they're involved, and then give the people a premium based on working in those higher risk professions like the meat packing, hospitals, you name it. There's a bunch you could list this, and that wouldn't cost. You know, we're throwing away trillions of dollars. I think 100 million or two would probably cover that.
I
want to stop there just because we had some unity between St. Louis and San Diego, which we don't always see. So I want to thank you all.
Thanks,
Ari,
Pete.
Ari, Bill, Joe, Jude, Lynn, and Pete and Ray. Thank you all. Thank you all for watching. We'll be having more of these conversations with these folks and others. If you're interested in participating, drop us a line and let us know. I'm Mark Halperin. Thanks for watching Wide World of News.